What inspired me towards the medicine? As a child, I was drawn towards the human body, and it's very fascinating to see the healing process that a human body does to itself. And on top, my father also inspired me towards the helping the people who are in need, and this all drawn me towards the medicine. My specialty is gastroenterology. Gastroenterology is a unique blend of complex diagnostic skills, and it also provides the procedural skills, and it gives an opportunity to establish the long-term patient relationship. That's what made me to choose gastroenterology. My approach towards the patient is compassionate, comprehensive, and patient-centered, involving the patient in their decision making, educating them on their condition, and focusing on the prevention and early diagnosis. My approach towards the patient is compassionate, comprehensive, and patient-centered. I focus on listening to the patient, involving them in decision making, and focusing on preventive care and early diagnosis, and reassuring the patient and improving their quality of life. I hope patients feel reassured, relief, and respected. I feel by the time they leave my office, they will have a trust, confidence, and they feel that they are receiving the best possible care for their condition. The most rewarding part is seeing patients regaining their health and quality of life, be it diagnosing early stage of cancer or helping them going through healing process of long-term diseases, and helping them during that healing process is more humbling and satisfying.